A lot of people think ICU nurses are really possessive over their patients, and we are. This is why. ICU nurses take care of the sickest of the sick patients. One wrong titration, one missed dose of a medication, one missed lab can be a life or death situation for these patients. That is a lot of responsibility put on the ICU nurse's shoulders. And so whenever someone goes into an ICU nurse's room and they're kind of hovering over that person that's going in the room or kind of hovering over the patient, it's just because they're wanting to make sure their environment is still in check. I had a doctor go into my patient's room one time while I was busy in my other room and actually shut off my patient's propofol drip, and they ended up waking up and self-extubating within a couple minutes while I was not readily there. So that's why if your ICU nurse seems a little OCD, type A little controlling, we're just trying to make sure that that patient is safe. We don't want anything happening to that patient on our shift that we are not in the loop on, because the last thing you want is for your patient to have a negative outcome or bad outcome because something was changed and you weren't aware. And so that's why ICU nurses may seem a little bit possessive over their patients. I promise it's all with good intentions.